All right, I think I might be on this time. This is my third try. Um, I am Kristen Stuppy, apparently technically challenged today. I've done this before and I don't know why this wouldn't go before, but it looks like this time I might be on. Let me refresh my other screen over here. I'm just going to verify because I just did 30 minutes of talking and it didn't show anything. I'm on this time. All right, I apologize for being half early. I finished up my talk and then realized it never did post live. So today is September 18th, and I am going to, for the second time today, talk about COVID-related topics. One of our followers on Facebook asked to talk about mental health related things, and so I will cover that. I plan on doing that last to give her a chance to catch on in case if I did it first, she missed it. So I apologize about that, but it still will be last because I have the slides set up to talk because it just makes it easier for me to know what I'm talking about. So I am going to share my screen here to help me know what I'm doing, and hopefully you guys can see because some of this is going to be a little tricky. So I'm going to talk about some testing recommendations and back to school, back to sports stuff, and that can be a little confusing. So my initial picture here is just kind of fun. I joke all the time with kids. In my typical garb, I look like I am a fish in fishbowl or a welder or an astronaut, somebody fun. So anyway, that is that. So talking about testing, our office is now doing testing. We use what's called an anterior swab. It is still a PCR test. The PCR tests are the gold standard for COVID at this time. There are also antigen tests that are starting to be offered at some locations. Those have the benefit of being pretty quick turnaround, like 15 minutes. They're not as reliable as the PCR, so sometimes they need to be backed up. But the testing that we do has been fairly reliable. Unfortunately, we are seeing COVID in town. So if your kids are exposed through school, sports, friend, or if you're exposed through coworker, whatever, if you get sent home, please, 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 as much as possible, isolate at home. I've had more than one family really upset because person one gets sent home and they keep doing what they're doing in the home because they feel like they're being quarantined. That's what they're supposed to do. But then that test ends up being positive, and everyone else in the family who has been exposed to them then has to start their quarantine. And if you can imagine a household of 4 or 5 people, by the time it works its way through, people could be home for over a month. I pulled the screenshot just to kind of show that this is from the CDC website. And the person in gray, the front part is the first person in the family gets sent home. Then if they're positive, they have to wait to not be considered contagious for their 10 days time. And that last exposure of that 10th day starts day 1 of the quarantine for family members. So if you can isolate that person in their own room, limit time exposed, wearing masks, things like that, you can move that quarantine for everyone else in the house back a little bit. Otherwise, families are going to be home the whole winter. One of the biggest questions we're getting right now in our office is my kid has a runny nose or my kid has a headache. When do we need COVID testing? This is from Children's Mercy, and I very much am thankful for our local specialists who have worked so hard to put together all of these guidelines. I anticipate these might change as we learn more and we figure out better ways to test or isolate or do whatever we need to do. Hopefully these will be changing. But for now, this gives us a good estimate of what to do if kids are exposed, whether they have symptoms or no symptoms, or if they have symptoms, whether they've been exposed or not exposed. So I'll kind of go through these a little bit more in depth here. And the first scenario is if a child has symptoms and they have a positive test. This is considered COVID, right? They have symptoms and it doesn't matter if they were exposed or not, they have a positive test. So we know they have COVID. They should isolate at home until they're at least 10 days from the day the first symptoms appeared and fever-free for 24 hours and symptoms are improving. Now, many of these kids are going to need not only the home isolation, but also if they get back into sports, they're going to need to follow some return to play guidelines. And I'll talk about that at the end. If you see me glancing to the side, I'm looking at my computer to see if there's any questions. Scenario 2 is if kids have symptoms and they know they were exposed. So the classmate or the friend or the coworker has COVID. So they know they've had an exposure. They have symptoms, but they have a negative test. Or if the test is not able to be done, because still, especially in certain parts of the area or country, there are still limited testing supplies. So if they're not able to get a test or the test is negative, this still could be COVID. They were exposed and they're having symptoms. Now, a lot of parents are upset because they hear that these kids need to stay home a full 14 days. The kids that have symptoms only have to stay home for 10. And the reason for that is a little confusing when you think about it just on the surface. But then if you start to think about why, it makes sense. The typical, if they don't have symptoms, have to stay home from 14 days of exposure or test date. And even if they have symptoms, if the test is negative, it could be that those symptoms were from allergies or a different virus. And really not related to that 14 days window that we think they might be exposed or contagious rather. So they need to be home for 14 days and isolate as much as possible, even though their test was negative, because if it is a false negative, which we know testing has at least a 30% false negative rate, if it is a false negative, you could still spread to other family members who might end up turning positive. So they need to be fever-free for 24 hours, like every illness, before they get back into the community, even if it's been 14 days, and at least improving symptoms. And for these kids, especially the high school level competitive athlete, I would recommend considering the return to play guidelines, even if they were negative. And that's something to talk with your physician about. Now, these kids that we're hearing a lot about, especially daycare kids, they don't have any known exposure and they have really mild illness. We test because they meet criteria for that, but the test is negative. What do we do with those kids? And our local experts are saying that we can let these kids go back to daycare as long as they meet standard recommendations, fever-free for 24 hours, not so sick that they can't participate in class or daycare. So treat them like a typical illness. And then the fourth scenario is if they have no symptoms, but they have a positive COVID test. Now, these kids might have been tested because they had a known exposure or because of surveillance. A lot of colleges are starting to do surveillance testing, which can help the community know the baseline guide or baseline levels and identify those people who wouldn't otherwise know they had it. But if they have a positive test, then they need to stay home and isolate for 10 days from the test date. Now, since they don't have symptoms, they don't have to wait for their symptoms to go away. But if they develop symptoms after the test date, then they should be fever-free for 24 hours and follow those guidelines as well. All right, so still no questions. The return to play after exposure. What is all this about? Probably by now you guys have heard of the athletes who have been taken out of competition off of sports teams because they developed heart complications. There's something called myocarditis that we know happens with many different viruses. COVID is not unique to this, but it seems like it happens more often with COVID. Now, because we don't know true COVID numbers, we haven't studied it long enough, we might be wrong on this point, but for now, to play it safe, because student athletes or young adult athletes might have heart complications after coronavirus, it is recommended that they get screened. Any high school student who plays sports through their school in Kansas and Missouri and many other locations are going to have a form signed by their physician to return to play. Now, this form might require just an exam. It might require more things, and that depends on the level of intensity of the sport, the age of the student, how sick they were at the time of coronavirus. So hopefully your physician has that kind of plan in action. Our office is following the Children's Mercy guidelines because they're the local experts. Other offices might be following something different, but in general, they need to be symptom-free for 14 days. Now, this might be longer. We already just said that 10 days is how long they need to be isolated. They need to be symptom-free for 14 though. So if they have symptoms for just 3 days and their isolation ends after day 10, that's only 7 days after their symptoms. So they need to wait another 7 days for that 14 days. And that's to let their body recover, because we think this might allow their heart to heal better in case of problems, because they might not have symptoms of heart issues. And I do see a question, so I will get back to that one. But we want them to be symptom-free for 14 days prior to even coming to the doctor to get their test or their evaluation to see if they can return to play. The question being asked by Jennifer is, if everyone's masked during the exposure, do people need to quarantine and isolate? And the official ruling or guideline on that is, because community masks are worn inconsistently, they're made of different materials, community masking does not meet the criteria. Hospital-based masks, where people have been trained and they're using medical grade masks, that is a different scenario, but in the community, masks don't make a difference. And we're all kind of learning on that. And I just told everyone, if you're at home, wear your mask if you're in the same room with someone, and try to limit time, because that can help. We know that it helps. We know that even cloth masks that aren't medical grade do help. We just don't know how much they help. So if your student was sitting next to another student in class, less than 6 feet for more than 15 minutes, even if they were both wearing masks, they're still going to be sent home, and the health department will consider that a risk for exposure. In the home, you're going to have to work with the health department on that specifics. Some of that's going to depend on how well you know that people are wearing masks and the quality of masks and everything else. And there's just a lot of unknowns, and I can't really explain that entirely because nobody really knows. They're still testing different mask materials and everything else, but it's a great question, Jennifer, and sorry, I can't answer it better than that. Anyway, getting back to the return to play. Once your child is cleared, and that clearance might be just listening to their heart, lungs, checking their oxygen, and saying that their symptoms were minor enough, their age and competitive level are low enough that that's all they need. Some kids are going to need an EKG. Some kids are going to need an echocardiogram. Some kids are going to need a full cardiac evaluation. And that really depends on the exact situation. But once they can return, once they're able to return to play, it's kind of like concussion guidelines, where they have the return in phases. It takes at least a week to complete all these phases. So just because your kid is cleared does not mean they can go play the big competitive tournament this weekend. Phase 1 is at least 2 days of light aerobic exercise for just 15 minutes. Day 2, or phase 2, is just 1 day, and that's up to 30 minutes. Phase 3 is another day of up to 45 minutes. Phase 4 is at least 2 days of 60-minute training. And then phase 5 would be back to regular activity and competitive play. During any of these phases, if your child develops chest pain, difficulty breathing, shortness of breath, not able to tolerate the exercise for that amount of time, dizziness, fainting, any of those symptoms, they need to be seen again. Emergently in the ER if they faint or have some significant issues. If it's just a little bit of difficulty breathing, you can certainly contact the office and we can kind of guide you through that. But that's because we want to make sure these kids are safe. All right, so on to the mental health. That was the one question that was asked before the talk. And we all have stressors right now. Even people who are mildly affected by the pandemic are still affected by the pandemic. Lives changed completely back in March, where we were all completely isolated. Some essential workers were allowed to go to work, but for the most part, everybody stayed home. People were even afraid to go outside for some fresh air and exercise. As time has expanded and we've learned more about the risks and what we can do to help limit our risks by wearing masks, washing hands, keeping a distance, staying outdoors. If you are indoors, trying to open a window, get some fresh air circulating. Those things we've learned can help. So we are able to get back to a little bit more of normalcy, but there's still a lot going on. Parents have lost jobs, which again, of course, leads to like food insecurity, home insecurity, healthcare insecurity. All of these stressors can lead to abuse, whether it's a partner abuse, a child abuse. Unfortunately, that has been an issue, which again adds to the stressors in a family. Some kids are experiencing loss that they've never had before, or they're scared because their parent or loved one is in the hospital and they know they're really sick. Kids have lost their favorite activities, and we shouldn't minimize that. I mean, to some people sounds like, oh, not a big deal. Kids can't play soccer. Kids can't do this. Kids can't do that. It's huge for these kids who haven't been able to get back to their activities. Some have been able to get back to some activities, but others still can't because either their family's not comfortable with the risks of that activity, or that activity is not back yet. A lot of kids that do theater, musical theater, hasn't started as far as I know, because singing is one of those high risks and it's hard to sing with a mask on. And it's usually indoors. And if they can do it outdoors, if they can find safer ways to do it, that's what I think will help a lot of kids to get back to somewhat normal, is by adjusting what we can do to make it safer so we can still do the activities we like. We all like to know what to do, what to anticipate. Our bodies thrive on routines and expectations. And when that's just thrown out the window, that has led to problems. So we all know this stuff. We don't have to even think twice. We all know what is stressing us out and what's stressing our kids out. Some of the things are better though, and we need to remember that for some kids who struggle with social anxiety, they don't like to go to big crowds, they don't like to do things. This has been fantastic for them. And what we have to remember is these kids are going to really struggle when they have to go back to classroom, when they have to go to a busy store, when they have to do things back in group settings. So I hear from a lot of families who say, oh, their anxiety is better, I don't worry about it anymore, it's not a big deal. These are the kids I really want to work on management techniques so that when they do get back into more of a what we used to think of normal routines, they're prepared. So this is an ideal time to work with a therapist, or at least some workbooks or something to help with them manage their social anxiety. A lot of kids, especially teenagers, got so much better sleep. Now their sleep might be off schedule from normal nighttime sleep, daytime awake periods, but teenagers got a lot of good sleep this past 6 months, and that's been great for them. I hope they can continue it as they get back into school. And because most of them have somewhat limited schedules now compared to before, I still think they're going to have less things on their plate so they can handle getting their homework done and still getting to bed on a decent hour, hopefully. One thing that we need to recognize is a lot of kids are feeling less threatened. They're getting less bullied. Unfortunately, bullying happens through this a lot. So some kids are still bullied through social media, group chats, things like that. But I have heard from more than one parent that their kids are participating better in school already, because I think they're not feeling threatened. The kid's not picking on them. They don't have to raise their hand exactly. The Zoom allows them to do things a little bit less threatening manner. So for some things, there are better mental health things right now. This is kind of a busy slide. In the very big center, I put a handout that I actually used for a different talk that I did for the local ADHD KC group. And if anyone's interested, just comment and I can post a link to that. And it was just a thing that you can print off and put little signs, little notes to self to make yourself feel better, because that positive thinking, we all tend to ruminate on the negative. We always think about the negative things and we feel bad about ourselves. We are the worst to ourselves. We can treat everyone else nice, but we're mean to ourselves. We always have those negative thoughts that keep recurring, self-doubts. And sometimes it just takes posting those little signs. I am kind, I am smart, I am worthy, those kinds of things around. And parents can do that for kids. Kids can do it for each other. Kids can do it for their parents. But those little reminders can be very helpful because we have healthy and unhealthy ways to cope with stress. And healthy things are what we all know. We have to eat right, exercise, sleep, practice some gratitude and positive thinking, having a growth mindset, learning some mindfulness activities. There's a lot of great free apps that you can learn mindfulness. Some are specifically geared towards kids, some are more for adults. But that has been shown to help when you're having stress, to kind of relieve some of that stress. Sometimes it's as simple as changing the scene. If you're getting frustrated with math because math is hard, you see your kids getting frustrated, sometimes just taking a little break. And you might need to set a timer so that that little break doesn't turn into 5 hours of watching videos. But watching a funny video, taking a walk, shooting some hoops, whatever it is that can help your kid just kind of change that mental attitude and get back to a place where they can start to focus again. Sometimes that's all it takes. Sometimes coloring, doing art, knitting, dancing, singing, all of those little things that can just change the scene for a minute, get your mind frame different. One of the things on my list is acts of kindness. If we do nice things for other people, not only are we helping them, but we feel better ourselves. It is amazing how much doing things for others can be rewarding and just change our whole mindset. So I encourage that for everyone anyway, doing random acts of kindness and focusing on gratitude. If things do things nice things for you, then you can focus on those, because our brains, again, wired to think of the negatives. But if we take time each day to focus on the positive things and write them down, talk about them at the family table, those kinds of things can change our mindset for a long time. Sensory, I have on here too. A lot of kids do better if they have something tactile or smell. Sometimes smells make us feel good. I mean, I can still, in my mind, picture my grandmother's house and I can smell her house. I know what it smelled like. That is a very positive, powerful memory. And smells are very much ingrained in our brains. So pleasant smells can help us feel better. And one of the things on here is taking news and social media breaks. For the younger kids, just try to keep them out of the news. They don't need to hear a lot of this stuff. For older kids and adults, it can be very helpful to know knowledge is power, understanding that this knowledge is going to change over time because we're learning a lot. And I think that's frustrating in and of itself for a lot of people. Don't wear a mask, do this, don't do this. I think that is one of the frustrations, is we know that things are going to change, but at least knowing that it's because of the scientific process that things are changing, expectations change, recommendations change. It's because we're learning more and we're building upon our knowledge base. The Common Sense Media link that I have at the bottom there are a lot of free apps that can help with mental health. And I love the Common Sense Media site. I recommend it for movies, books, video games, all kinds of things, but they really have some good resources. And I will try at the end of this, if I remember, to put that actual link that's hyperlinked into the comment section under this video so people can look at it. It's a great resource for all kinds of things. Thank you for the kudos, Courtney. The unhealthy coping with stress, we all have seen this in people that we know and love, whether they're kids or adults. If you recognize some of these unhealthy coping mechanisms and you can't address them at home with your family member or a friend, this is time to seek professional help. But if they're self-isolating and they don't want to come out and talk to people, they're avoiding others. Of course, drugs and alcohol, unfortunately, are something that we've known for years. If people are depressed, they try to drink to feel better. And we all know what happens with that. You feel better temporarily, but long-term, it ends up making things a lot worse. And unfortunately, teens and adults tend to drugs and alcohol a lot when they feel bad. So obviously, we don't want our kids doing either one of those. But if you notice that your kids are doing that, don't just punish them, because punishment's not going to help. If it's because they're feeling bad, they need professional help. Overeating is another thing. We eat when we're bored, we eat when we're sad, we eat all of the bad things when we are not eating from hunger appropriately. So that can be a problem. And then too much or too little sleep. Sleep is good. We need sleep. But if kids are sleeping too much or too little, or if adults are doing those things, that's not healthy. If we're avoiding tasks, if we put things off and we just don't ever finish anything, that can be a sign of being overwhelmed and not handling stress well. And when people a lot of times do that, they're getting involved in watching TV all day long, watching videos or doing things that are just wasting time. We need to be productive. Being productive lets us feel better. So the opposite of that just makes and exacerbates the bad feelings. And then negative self-talk, I've already talked about. How can we support our kids? There's a lot of free resources online. If you need any of that, again, post in the comment section under here, and I will put some more links in here. But one of the links I have on here is the CDC website for children in disasters. I just did a quick search and found this. It's little printables that you can print out for kids. You can also talk to them using help from books. One of my favorite places to go is the Amazon bookstore, because you can read summaries and it suggests similar titles, and you can kind of read all of the whatever people review and find one that fits your situation you think your kids would like. and work together on learning about anxiety and what to do when you start to feel anxious or sad. And if those coping skills help, then fantastic. If they don't help, then it's again time to work with a professional therapist. Provide age and developmentally appropriate answers. Just because two kids are the same age does not mean that they're at the same place with able to understand things. So work with your kids. And if you're not sure, again, talk to a professional for some suggestions. And then we need to model healthy response. If I get really frustrated and upset and yell and scream and throw things, that's what my kids are going to do, because that's what I'm modeling. If when I get upset, I take a big breath and oh, I'm really angry that that happened. I need to take a moment. Let me calm down and model some of that behavior. Talk about, name your emotion. Talk about what you're doing to make yourself calm down. Your kids will see that, and then they will start to incorporate some of those things. And that's hard, because whenever we are angry or sad and those emotions just hit us, our natural tendencies tend to take effect. So we have to be cautious when kids are watching, or even when we think they're not watching. And that betters us too, because we can then practice those techniques. And if you're struggling with that, again, talking with a professional. And I know it's hard to talk to professionals. Time, money, insurance coverage, all of those things can be difficult. Our county does offer, and most local counties do offer, healthcare, mental health care through the county. So if you need that, they are overwhelmed and backlogged. So sometimes you need to use insurance or even cash pay people. But if you have trouble finding people, let us know and we can give you some resources on that. Again, maintaining routines. Our bodies thrive on routines. We need routines. So even if you don't have much to do, get up, have breakfast, brush your teeth, get dressed, try to have a time for exercise each day. Try to do these routine things, because our bodies thrive on that. And if your kids are doing at-home learning, trying to have them sit in a similar place most days. Now, there are some kids who do better if they have a change of scenery. Sometimes they sit outside on the deck. Sometimes they lay on the floor. Sometimes they sit at their desk. If your kids report that they do better and they actually show that they do better that way, let them do that. Don't say they have to sit at a desk, because sometimes I think that can be counterproductive. But similar time frames of things each day. And again, the bottom here is seek professional help if there's concern. You can always call us. You can call your doctor if it's more you that's struggling, or reach out for a therapist. I don't see any other questions, but if anyone does have any more questions, please pop them up here and I'm happy to answer them. I will also post a link. I did that whole talk previously on anxiety and the pandemic, and there are some other things in there that I covered. So I will link that, but I think this talk is getting long enough, and it's the third time I've tried it. So I am sorry, I had some linkage issues today trying to get the whole screen share thing going and everything else. But if there are no other questions, thank you for watching. And if you have topics that you'd like to talk about or have us talk about, you've probably figured out by now, each Friday, one of the doctors, whoever's doing hospital rounds that morning, does a Facebook Live at 11:30. If you have something you want us to talk about, let us know. We're happy to talk about whatever you guys want to hear. And next week's talk will be posted at 11:30, hopefully on Friday. Hopefully they won't have the connection issues I had. All right, I'm going to hang up because it doesn't look like there's any more questions. Thank you, guys.